we are talking about prevention, which is definitely the power, healthy eating for children with diabetes. So please welcome on set Dr. WOOI, a pediatric endocrinologist from Sunway Medical Center. Welcome to the show, doctor.
Thank you for having me.
You know, it's a bit uncommon, right? When we talk about diabetes, it's usually associated with adults. But here we are talking about children. Why are we even talking about children these days with diabetes, doctor?
It's quite surprising to you, isn't it, that children can get diabetes, but it actually, a lot of them, actually. So a lot of my patients will be, you know, like 13 years old, 14 years old, they already got like type 2 diabetes. So.
Right. And why do they come and see you? Is it because of some symptoms that they show, or, yeah?
So it really depends on which type diabetes that we're talking about. If we are talking about type 1 diabetes, it usually they present quite severe. So they usually present in the emergency department, and they usually are very tired, they vomited a lot for 1 or 2 days. So they are very sick for type 1 diabetes. Type 2 diabetes, usually they come in with obesity into the clinic, and they have presents with, you know, sometimes they just pee too much or drinking too much water. The family is concerned. So there's a bit of difference.
Of course, once we talk about diabetes, I mean, we have seen the damages done to the adults. Of course, you know, cutting of the limbs is one of the things that come out as a result, unfortunately. But maybe, like for me, personally, I don't really know what the damage could be like in kids. So can you tell us if these goes untreated, what will happen to these kids?
So isn't it scary? So, you know, I remember when I was in training. So I do have a family that the mother will bring the child in to see me for obesity. The child is obese, just has a little bit of sign of insulin resistant, basically, which means that not into diabetes yet. So the child will push the mother into my clinic, and the mother is actually amputated because of the type 2 diabetes, and mom is also blind. So the child came in without diabetes, and we were doing all this counseling for diet and exercise. But, you know, after months and months and months, the child was not following the diet and exercise plan. And what happened was the child ended up having type 2 diabetes. And the child was just couldn't take it because he did see what happened to the mother. But, you know, that he just didn't think that it could happen to himself.
May I know the age of the child?
He was, I think at the time, was about 13, 14 years old. Yeah.
13, 14 years old.
Scary.
This is definitely scary. But anyways, Dr. Cheng, before we dive down further into diabetes type 1, type 2, and how children can actually avoid this altogether and what they can actually do if they are victims of these two types of diabetes, what is your role first and foremost as an endocrine specialist? Yeah.
Isn't it? So a lot of people will be asking me, what is pediatric endocrine, right?
That's right.
Hormone doctor, and when we talk about hormone, you would think about puberty, right? So basically, actually, we are not only doing puberty. We also treat children with diabetes because that involves insulin. We treat kids that is too short. We treat kids which is too tall, too early into puberty, too late into puberty, thyroid condition, and also like condition where they couldn't absorb water. We call it diabetes insipidus. So there's a lot of condition that is actually treated by endocrinologists.
Okay, maybe you can shed some light on some of the treatments. I mean, I guess you are approaching the treatments from the hormonal point of view, so maybe you can enlighten us.
That you mean that all these different conditions?
I mean, treatment to type 2 and type 1 diabetes.
Sure.
Available, right?
So, for sure. So, there is, first and foremost, the type of diabetes that we talk about, right? Type 1 and type 2 is very, very different. So, the treatment is also different. So, when we talk about type 1 diabetes, it is not so much of not healthy eating. Those are actually quite the myth, isn't it?
Yeah.
So, we used to say, you're not eating healthy, you're eating too much sugar, that's why you're getting diabetes. But it's not very true for type 1 diabetes. So type 1 diabetes basically is an autoimmune condition where your antibody is attacking your own pancreas and you're not able to produce insulin.
Right.
And this happens usually to kids that's very young. And and these kids are not obese and they're very slim, they're very young. So for type 1 diabetes, the treatment for sure, because they cannot produce insulin, the treatment is insulin. So they need to inject themselves before they eat and at night. So basically about 4 to 5 times insulin a day.
Right.
Isn't that a difficult procedure, though? The kids can do them themselves?
Well, if they're old enough, they can do that themselves. That involve a lot of different calculation of how much insulin to inject, and that's for type 1 diabetes. And for type 2 diabetes, basically, it happens to more older kids. It also can happen to younger kids, but usually kids that is more obese, that has sedentary lifestyle. And for this patient, we usually treat with just oral medication, because what happens is that their body can produce insulin. It's just that the body has resistance to the insulin. So that's the one that we say, you know, you have to practice diet and exercise and healthy lifestyle.
Right, right. So if you're just joining us right here on Fresh Brew, we're talking to Dr. Cheng. She is the Paediatric Endocrinologist. We're also talking about diabetes among children. Doctor, first and foremost, right, we just mentioned about type 1 diabetes and type 2 diabetes. And, well, you just mentioned that there are differences between these two, right? But are the symptoms similar to the two of these types that we're talking about? And why do I need to see an endocrinologist in the first place?
So their symptoms are very similar, because at the end of the day, it's high sugar in the blood. So what happens is that when you have very high sugar in the blood, it's going to pull your water out. So you're going to keep on peeing. So a patient that has diabetes, they will have something we call polyuria, means that they pee a lot. Polydipsia, because when you pee a lot, you become very thirsty. So you're going to drink a lot. So they will also have weight loss. So why is that happen? Is because, you know, when you have either you have not much insulin or not enough insulin, what's going to happen is that when you have high sugar in your blood, so then the insulin works as pulling your sugar into your cell to use as energy. But when your insulin is not working, your cell doesn't get the fuel. So then you can get a lot of weight loss with that also.
Ah, so that's how it works.
Yeah.
Sorry, yeah. You
So
mentioned
you have polyuria, polydipsia, and also weight loss.
Yeah, but you mentioned before that the focus is not solely, in terms of treating these patients, it's not solely on the diet. Because I thought that that's how the parents could help.
Yeah,
The parents could
yeah.
help with preparing nutritious meals, making sure they eat on time, making sure that the amount of calorie and everything, it's all on par, it's all balanced. So how can the parents help now? I mean, if it's not just solely through diet, what are the other ways for them to help?
So actually, you're totally right about the diet, exercise, on both of them actually. Why is that so? Because even if you have type 1 diabetes, you also need to eat healthy. Because we don't want from type 1 diabetes and then you become obesity and then, you know, it increases more risk of your problems.
Right.
So for both of them, the parents can help with giving a very balanced diet. And again, for type 1 diabetes, not so much on they not eating healthy. So we don't want parents to think that they cannot, the child cannot eat, you know, have to control their diet in terms of they cannot eat ice cream, they cannot eat anything sweet. For type 1 diabetes, it's okay, but you just have to have a balanced diet. Because can you imagine, you have a kid that is 4 years old, 5 years old, other child is eating ice cream and, you know, it's a no for him or her. So basically for type 1 diabetes, you have to have a balanced diet, but at the same time, we don't restrict your diet. For type 2 diabetes, yes, diet and exercise. So parents can help by, you know, encouraging them to eat healthy, encouraging them, bring them to park, you know, bring them to walk and to exercise, and cut down on the screen time. Yeah, I think that's very helpful for the parents.
That's the biggest challenge, isn't it, doctor? Cut down on screen time.
We're on screen right now.
Exactly, that's one. And number two, they don't move much, so that's why that jeopardizes their metabolic rate. And there you go, you put on weight, and then we just don't want to talk about someone ending up with diabetes. Now, doctor, are there any latest technology with regards to treating or curbing this issue?
Yeah, so imagine type 1 diabetes, what's going to happen to them. So when they are diagnosed, what happens is that they need to inject themselves with insulin 4 to 5 times a day. And they need to check their sugar 4 to 5 times a day. Even earlier when I said that you might get the blood sugar check, you got so scared. So it is tough. It is really tough. So nowadays, we have more and more technology coming up. So I actually brought a prop. So what happened is that now we have sensor. So you can just place the sensor on the patient's body.
Right.
And then they can actually scan the sugar to see what the level is.
Okay, that I want to do. Can I do that now?
You want to do that now?
Yeah, why not? It's just a
But
sensor,
there
right?
is still a filament. So it's still a filament that goes into your body. It's not really a sticker. It's still a small filament, but it's not painful at all.
Would you like to try to do that?
I think, Nabil, you should. You're closer to
No,
doctor.
I don't want to know the outcome, man. I'm scared right now.
Later.
Okay, we'll do this later.
Yes.
Yeah.
So this is a blood sugar check because instead of us poking, now that we can scan. So you just change this every 2 weeks. The other things that people do now is that they have the insulin pump. Instead of me injecting myself every 4 to 5 times a day, every time I eat, now that they have an insulin pump that can deliver the insulin to the patient.
Automatically.
There is an automatic pump and there is a manual pump.
Okay.
The manual pump is not that expensive. The automatic pump is very expensive. What happens is that the automatic pump can actually has the sensor. It will detect your blood sugar and it will go up and down the insulin depend on what your blood sugar is.
Oh, wow.
Right.
There you go. As we're taking a look at the screen right now, glucose sensor, insulin pump, so that's how it works.
Yes.
You still need the sensor for this to work, actually.
Correct.
Right.
It's good to know that technology is helping, but I wonder, is this, I mean, if some parents out there find out that their kids have diabetes, either type 1 or type 2, or maybe not be the same for both, is it a lifelong condition? Is it possible for them to be cured?
So unfortunately, there is no cure for type 1 diabetes. However, you can manage it. For type 2 diabetes, sometimes with diet and exercise, you can go into remission that you might not need medication.
Right. Ah,
That's good to know.
right. So Nabil mentioned about the risk factors a few minutes ago with regards to diabetes. Is it similar to adults if they have diabetes? And Nabil spoke about how one might actually lose their leg, their limb, and that's the thing that we actually don't want anybody to result into. Is it similar with kids?
Yes, it is similar to kids. So that is why that kids that has diabetes, we usually want them to have eye exam done every year. We want to have kidney function, means that we want to check their blood to make sure their kidney is okay. And then we also want to check their legs to make sure they're okay. So if their blood sugar is in good control, those risks is getting lower. But if their blood sugar is very high, sometimes the risk is getting very high, and which they will get all these complications very early in their life.
But I wonder, because when I talk about my childhood nostalgia, of course, most of them are made up of the sweet desserts, either local or international. We talk about candy bars, we talk about, sweets, all those sweets that we find at a convenience store. And sometimes I do notice that my parents used to incentivize these sweet treats as,
And good thing, back then we didn't have bubble tea, Now we do.
Now we do.
Right?
So I'm just wondering, doctor, is there no room at all for kids to consume some sugar in their diet? So, I mean, is it okay for some of them to have it every now and then?
That's a very good question. So for type 1 diabetes, I'm okay for you to take candy. I'm okay for you to take ice cream. You are a kid. I'm okay for you to take those things. I totally don't say no for all these things, but take in moderation. Everything needs to take in moderation. Type 2 diabetes, because of the obesity, we really want to cut those down. So yes, you can have that maybe once a week. We'll have a discussion with the parents and see if we can cut those down.
Okay.
Oh, nice.
It's not too bad.
Why do you sound happy, Nabil?
Yeah, because I love my desserts, and I'm just wondering if these kids.
Right, yeah. We care for them as well.
Yeah.
Especially when they go to school, they go to kindergarten. Some parents will share with them some candy and stuff like that. It's good and it's bad at the same time, because this is what happens if you take it excessively, then you'll be in trouble. So as parents, we need to not put them, push them aside and say, no, you cannot take sweet stuff. You need to reward them once in a while, but you got to watch their diet. Now, doctor, can you please share with us what the No campaign is all about at your place?
So the No campaign is actually now in Sunway for the whole month of the World Diabetes Day. So we try to show the public or give awareness to the public, prevention is power. So we really want the kids to, or the parents to know to eat healthy so that we can prevent type 2 diabetes. So we have a lot of different booths. You can stop by anytime. So there is, the hula hoop challenge, or there is, we can have a blood sugar screening that is for free. And we also have the, what do you call that? The machine that you check the fat composition in your body.
The BMI?
Very good.
No, that's not going to be.
Yeah, they check your fat composition in the body, which is really good. That you see whether you are, overweight or like what is the amount of fat percentage in your body. So.
Yeah, and
You're featherweight, don't worry.
yeah, and when we talk about diet, right? Monkey see, monkey do. I guess the parents have to take charge and be the role models for these kids in terms of what they are consuming.
Yeah.
Yeah.
What you said is actually very true.
Yeah.
Nabil, now that you actually said that, now it reminds me, you know how when it comes to babies these days, right, how parents would actually prep their meal. And then you can get something from the convenience store or wherever they can actually buy this from, which is literally very quickly you can just prep themselves the meal and then you just give it to your kid. Then again, there are artificial flavors, there are artificial sweeteners and whatsoever. Doctor, this is a problem, isn't it?
It is a problem. So it is, I would say, like a first world problem, isn't it? That everything is processed.
Yeah.
Everything is wanted fast. But I still believe that, home-cooked meal are healthier. So without all this artificial coloring, artificial flavoring, would be better.
Right.
Yeah.
All right. Thank you so much, Dr. Cheng. I'm just wondering if you have any last words for the parents or for the kids who are watching.
And
maybe they just find out that their kids are diagnosed with type 1 or type 2. Like, what some words of comfort that you can give to them?
And also the myth surrounding this whole thing altogether.
Oh, that is very important, the myth. Tell me a little bit about what do you guys think? What is the things that you always hear about diabetes that you kind of like, is it true, is it not true? Is there anything that's in your mind right now?
Okay, if you have diabetes, just cut down on your sugar tremendously, which is not entirely true because you need sugar, you need that energy, right?
Correct for type 2 diabetes, you should cut down and then you can have a little bit. For type 1 diabetes, yeah, we don't ask you to cut down. We want, a healthy diet, a balanced diet. So I would say part of it is a myth.
Yeah. Nabil, do you have any?
I have one. If you have diabetes and it goes untreated, you will have your limbs cut. Is that true? Is that the only bad thing that comes out of it?
Well, that's not the only bad thing. So, so of course, we talk about the eye problem, the kidney problem, and also the heart problem. So the other one that is very, very, a lot of people will talk about, they said that if you eat too much sugar, you'll get diabetes. What do you think about that?
Yes, I believe so.
I believe so too.
No?
It's a myth.
It's a what?
It's a myth.
Right.
So basically, well, we talk about type 1 diabetes, type 2 diabetes. Type 1 diabetes is actually an autoimmune condition. It doesn't be caused by you eating too much sugar.
Right.
And type 2 diabetes is also because of you being overweight or obese that causes your insulin not working. And it's not because you take too much sugar making you go into diabetes.
Right.
So,
Okay. And one more, Ms. Nabil, if I may,
I have
please.
one more.
Oh, okay.
Why don't you go?
All right. Two more, doctor, yeah?
Sure.
You are skinny, you don't have diabetes.
So type 1 diabetes happens to people, usually people with type 1 diabetes are skinny. So because of autoimmune condition, right? So you don't need to be obese to get type 1 diabetes. So that's a myth.
All right. Okay, Nabil.
One last one. These kids have diabetes because their parents have diabetes. It is hereditary. Is that true or not?
Wow, that's a good one.
Yes, it's a good one. I think partly it's true because partly it is actually caused by genetics. So if your parents have diabetes, for type 2 especially, with your parents have type 2 diabetes, you have increased risk of type 2 diabetes. Type 1 diabetes is lesser, but it's still a bit familiar.
Okay.
We are out of myths for now. I think, Doctor, thank you so much for your time. We really appreciate it. And yeah, definitely learn new things today. And I hope you guys have been learning as well. Thank you so much again, Dr. Cheng Tong-Woi, who is the Paediatric Endocrinologist from Sunway Medical Center. I got the word right.
Yeah.
Congratulations to me and also congratulations to Doctor for coming here and teaching us all this. Thank you so much.
Exactly.
for spending
Thank
your
you
time.
so much.